Breast cancer is diagnosed every 29 seconds around the world, and in the United States, it's diagnosed every 2 minutes. Besides lung cancer, breast cancer is the most commonly diagnosed disease among women in the United States. Personally, I have had many friends and family members struggle through this disease. Therefore, I consider it to be of great importance that people become educated on this particular type of cancer. Together, we're going to examine the causes of this disease, look at the signs or symptoms, and acknowledge the methods of prevention or early detection. Firstly, let's take a look at the amount of people affected and what the causes are. Since its origin, breast cancer has become increasingly common throughout the nation. The American Cancer Society predicted that in 2018, over 300,000 women would be diagnosed with some form of breast cancer. More specifically, they predicted that of these 300,000, 260,000 would be diagnosed with invasive breast cancer, while just over 60,000 would be diagnosed with non-invasive breast cancer. According to the editors of breastcancer.org, 1 in 8 women will be diagnosed with invasive breast cancer in their lifetime. Also, according to this site, as of January of this year, 3.1 million women will have a history of breast cancer. As for its causes, it's difficult to determine exactly what the cause may be, as every woman and man's case is unique, says Healthcare Central. However, it is clear that damage to the cell's DNA is a contributing factor, as this is observed wherever breast cancer is detected. In addition, the National Breast Cancer Foundation states that there are several risk factors such as alcohol consumption and hereditary tendencies. Now that we've examined the masses affected and the causes, let's look at the signs or symptoms. What are the general or most common symptoms of breast cancer? Well, according to Medical News Today, the most common sign of breast cancer is the development of a lump-like tumor or ulcer in the fatty tissue of the breast. These lumps or ulcers often feel hard and immovable, unlike lymph nodes, also common in that region, that are smaller and softer. Another common sign of breast cancer, according to Fred Hutchins, Cure Starts Here, the redness and skin sores around the breast and chest area. This can result in scaliness or soreness of the skin and can spread from the breast to upper chest and even across the arms. WorldwideBreastCancer.org states that a less common sign is the swelling of the lymph nodes under the arm and around the collarbone. Of course, there are preventative measures that can be taken to reduce the risk of breast cancer or promote early detection. In terms of prevention, the National Breast Cancer Foundation encourages limiting alcohol intake, as this may be a contributing factor to the development of the disease. Another preventative measure, and the most highly recommended by healthcare physicians, is the self-examination. For women, self-examination should become a regular practice after their first menstrual cycle. Regular examinations promote familiarity with one's body to increase ease in detecting abnormalities. One preventative measure, common in the prevention of most diseases, is to remain physically active. It is recommended by Health Central that the average adult get 150 minutes of moderate exercise per week. Exercising lowers blood estrogen levels, which reduces the risk of breast cancer. For early detection, mammograms are the most common method for detecting breast cancer. Through early detection with mammograms, those diagnosed have a greater chance of having surgery to remove the tumor rather than undergoing extensive treatment. Today we learned about breast cancer, one of the most common diseases in the U.S. We looked at the statistics and causes, the signs or symptoms, and prevention and early detection. The more common this disease becomes, the more we all need to be aware of it.